Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Uterus. Uterus is pyriform shaped. Uterus consists of body, corpus or fundus, which is the major part. It contains isthmus and cervix. Fallopian tube attaches to the uterus, and the part at the site where the fallopian tube attaches to the uterus is called as cornua or uterus. Uterus opens into the cervix at the internal os. The internal os is a sphincter where smooth muscles are arranged in concentric manner. The uterine cavity is a potential cavity. Normally, the walls of the uterus are opposite to each other and they are not narrow. The size of the uterus is 3.5 into 2.5 into 1.5 inch. Uterus is lined by single layer of low columnar epithelium, whereas cervix is lined by high columnar epithelium. The place where low columnar epithelium of uterus becomes high columnar epithelium of cervix, it is called as histological internal os. The place where broad uterine cavity becomes a normal cervical canal, it is called as anatomical internal os. Histological internal os is always below the anatomical internal os. Isthmus. Isthmus is the space.
thank you and thank you for watching.